computer. Okay, so I'm very excited to share with you guys today two of the most rapidly evolving fields of sciences. This was actually originally a 40-minute presentation, so I really condensed it down significantly and simplified as much as I could without oversimplifying as to, compromise the accuracy of the sciences. So without further ado, a quick overview. First half, we'll briefly review and recap the fundamentals of a lot of what we've learned about rhinoplasty over the past month. And then the latter half will briefly explore the booming territory of AI and its use in the medical field. So as Dr. Eugene Tardy points out, we must have a really detailed anatomical understanding in all of the different things that we might encounter when we're lifting up a skin envelope. But the other part of this that's paramount is to understand whatever we're doing is going to change over time, and it's going to have outcomes that we want to monitor over the course of that patient's recovery. So seeing your patients back, not only the immediate post-operative period, but also 6 months, 9 months, a year, 2 years, like all of these monitoring opportunities are opportunities for us to learn what we do intraoperatively. So these post-op monitoring provides a very essential component to getting good, consistent results. So starting off with a very big picture of the nasal anatomy, you have the upper, middle, and the lower thirds of the nose. With this oblique view in the slide, you can see that the upper third is characterized by the paired nasal bones, and then the middle third by the paired upper lateral cartilages, and the lower third by the paired lower lateral cartilages with the medial, middle, and the lateral crura, which is normally angled obliquely towards that lateral canthus of the eye, with the remaining caudal portion of the ala composed of the fibrofatty tissue. And altogether, they form that external nose, which is lined by that external the skin that quickly transitions from the thick sebaceous cover along the nasal tip and the ala to the thinner skin along the dorsal and the sidewalls. And with this lateral view, you could appreciate the inner aspects of the nasal anatomy. Also in plastic surgery, we want to be mindful of the aesthetic division that constitutes the anatomy of the nose. Also, another really important feature of the nose surgeons really need to be mindful of is the major components for breathing, right? So with the external valves and the internal valves, and from this base view, we could really appreciate the columella with the relative septal turbinates. That's in this illustration, which you can see a slight deviation to the right there. And just wanted to bring this up real quick. These breathing functions really could be understood with the Bernoulli principle, where there will be reduction in the pressure related to the fluid speed increasing. So in simple terms, without this complicated equation that we all had to learn and memorize in Physics 101 back in high school, like if you could think of it as whenever you have a clogged up nose for some reason, like if you have COVID or common cold, the Omicron variant, you have to really force that air in, right? So what you're basically doing is you're increasing that velocity to account for that decrease in the internal pressure of that nasal valve. More so accurately, a combination of the Bernoulli and the Pasolini principle really represents a better model for understanding the breathing mechanism of the nose, with the flow rate being directly proportional to the pressure difference times the radius of the valve. And with this such understanding of these equations, we could really appreciate the mechanism by which we check and test the proper function of the valves by what's called this Caudal Maneuver, or the modified Caudal Maneuver more traditionally used here. So with this maneuver, you're basically mechanically increasing this numerator value, and so you subsequently get this higher volume flow rate in a very simplistic sense. So in rhinoplasty, there's numerous amounts of flaps, grafts, cartilages that can be utilized for the nasal reconstruction, as we all learned about. And of course, just like with any other operative procedures, there are potential risks, which can, however, be mitigated through different techniques. So a quick example, a lot of the middle third reconstruction involves the dorsal hump reduction and then reforming the middle third with either spreader grafts or what will be considered an auto spreader grafts. And the reason we do that is to avoid what's known as this inverted V deformity, which is this shadow that's an upside down V. And this happens because we may or may not have medialized nasal bones Either way, we're reconstituting the middle third with sutures. Just suturing the upper lateral cartilage back to the septum would result in this excessive pinching right here. So you get this relief shadow that demonstrates an accentuation of the upper and the middle third separations, which is what you obviously want to avoid. So we could use these spreaders or autographs to be able to lateralize the upper cartilages so they're more in line with that same nasal bone they're part of. So these spreadographs basically help reconstitute that internal nasal valve. And also, whenever you have a significant amount of hump reduced, you'll have this extra length of the upper lateral cartilages, and those can then be infolded so that you could get a more natural contour of that middle vault. So artificial intelligence, or AI, a very old concept and model that existed over decades. It's been a hot topic in medicine recently in the medical field, as many of its tools, specifically deep learning and computer vision, can be extended into the medical applications. Now, quick introduction of terms here, as these terms are frequently interchanged and used pretty inappropriately by the vast majority of the population. So the term artificial intelligence, it's a big term where we implement human intelligence to machines. Attractively, it's basically a study of how we can make machines that are able to understand the world, make predictions, choose appropriate actions, and so on. Essentially, to do all of the different judgmental processes that we associate with human intelligence, but presumably do these processes more efficiently than humans can. And machine learning, it's a domain of AI where we incorporate learning, specifically learning a function, where a function is defined as a set of rules or for transforming inputs into outputs. It's not some kind of a magic thing. It's not the right solution to every problem, but it is the right solution to problems where the relationship between the input and the output is complex and full of special cases, so that it's easier for us to provide examples than it is to implement those rules by hand. And so the deep learning is an extension of this machine learning, where you have these layers of parameterized transformation of preceding layer. It's basically based on the human brain model. So cool, right? So intuitively, with the deep learning, we could think of this as implementing layers of parameterized transformations stacked on top of each other sequentially, much like the mechanism of the pupillary constriction with the innervation of the parasympathetic fibers and the iris sphincter muscle. When you shine a light through an eye along the first order neuron, adding a Westphal nucleus, and the second order neuron to the ciliary ganglion, we have different layers that could extract higher levels of abstraction of like specific information with each subsequent layer and filters. I know that was a bit of a mouthful, but hopefully that makes sense to you guys. So I won't belabor the computational math here, as it could be quite extensive and I'm kind of running out of time. But what I found quite interesting from my reading was how this deep learning algorithm model, it really correlates with how the human brain works. To illustrate, we could compare the brain's V1 cortex at the prefrontal area to the V5 region towards the parahippocampal region of the brain, which is very comparable to deep learning neural network algorithm models. But then at the end of the day, we really need to keep in mind that these deep learning algorithms for neural networks are just a gross simplification of the more complex human neural system with, like all the neurotransmitters and hormones. So now it's really hard to keep up to date with all the different types of computer vision architectures using deep learning. And as the field is growing at such a rapid pace, it's really impossible to pinpoint what's currently the most state of the art. But here are just a few major family of networks that are out there right now that are pretty popular in research and development. And if anyone wants to learn more, I've linked them all over here, so you guys can check it out later. Now, these programs have illustrated remarkable success in the clinical settings, whether it be detecting subtle changes or aberrant alterations to the skin tissue that may be difficult for the human eye to distinguish or more so predict. And so these really can be applied to the analysis of the entire input of medical image scans. And on the bottom here, This is actually an example of a paper published in Nature demonstrating that CNN, convolutional neural network, can outperform expert radiologists at detecting breast cancer directly from mammogram images from the feature extraction modules that it was fed. So in rhinoplasty, we have also seen remarkable success in incorporating the convolutional neural networks algorithms to accurately predict the aesthetic age from the post-op rhinoplasty condition with the correlation coefficient value, the R value of being 0.91. So it's very close to 1, very strong correlation. This was a 36-year-old female, a pre-op and post-op, showing a decade younger. And additionally, many different mobile apps have been developed specifically for rhinoplasty procedures, and it was able to predict 85% of the status recovery for the patients. So as Peter Parker's uncle eloquently quoted, "With great power comes great responsibility." It's paramount to understand while AI can be tremendously beneficial, it also leaves room for misuse, such as potential falsification of patients' expectations. And so anyways, finally, as a concluding remark, our future era of rapid evolution is only going to further improve. So it's equally important for us to recognize and understand, at least a very fundamental aspect, this booming surge of technology and its potential use in helping to improve our medical system. That concludes my presentation.
Great, Jim. Very nice. I like the presentation. Can you tell us sort of what you think might